here at Primary Children's Taylorsville campus.
This campus is dedicated to pediatric behavioral health services. We focus on the child first and always, and all we do here is serve kids.
We've worked really closely with Taylorsville City to make sure that we are a place for this community.
Mental health affects everyone. Kids in our communities need help and support.
Utah has one of the highest rates of adolescent suicide.
And we continue to see rises in families seeking crisis care for their children.
One thing that's unique about this facility is that it has what they call a crisis center.
This facility is going to be Intermountain's first facility opening up for a pediatric crisis center. This is groundbreaking for Intermountain.
I'm honored to be the first to officially welcome you to the Intermountain Health Primary Children's Hospital Behavioral Health Center.
We are really proud to offer an entire continuum of care. That includes something like a short-term visit to our crisis center, or a week-long visit in our inpatient unit, or even several weeks with us through one of our partial hospitalization programs.
Kids can go to school here. It just takes a lot of dedicated people to treat these kids.
We want every child to have a chance to thrive and to live their healthiest life.
People who have spent their entire careers working in behavioral health are not used to working in brand new shiny buildings with lots of natural light and big open spaces.
The design of all of this, the construction, everything just came down to making sure the kids in this population are getting the care that they need, and it's a comfortable place for them and their families.
Whatever is going on with the patient, the kiddo who is here, is going on for the whole family.
The patient rooms are much bigger, huge windows. They've made the beds where if you are a parent, you can come and stay with your kid.
This facility was absolutely designed for family-centered care.
Where you are and what you're surrounded with impacts the way that you feel.
The healing atmosphere that they're going to get in these rooms is going to be huge.
When a child is struggling emotionally, it is a weight the entire family carries.
I am so thankful for all the years Primary Children's has been there for me with my medical and behavioral health needs.
I've been working for Jacobsen for a little over 20 years. Majority of my work has been in the healthcare department. I've been working with Primary Children's since 2012 and done probably over 40 projects with them. Working with a repeat client, we do have that trust level. They're not only a great owner, but they also are our friends.
I've worked on several healthcare projects. This is the first project I've worked on as a superintendent. Big learning experience. I have an amazing team around me, so they've taught me a lot.
What I love about the healthcare world is it's challenging, but it's also rewarding.
I came on this project in December of 2023. When I showed up, it was just an empty grass field. We were doing underground work, sewer, water line, storm drain. We built this on an active campus, so there are kids living here on campus.
We see the kids here on campus because some of them come here for school.
So early on, we were getting a lot of calls, hey, someone dropped some screws on the ground right outside the gym where the kids pass by to go to the gym every day. Like, to us, it's like we might just walk over that and not really think of it.
You can't have any wire out. You can't have anything where these kids can go and grab it and try to hurt themselves.
That was early on, kind of learned my lesson. We got to make sure like housekeeping is like top notch here.
They've been just great partners in keeping our kids safe in an active construction zone.
You just have to have that little extra level of care and caution.
How
valuable is it to have a building partner that you can trust and rely on and that you think really captures your vision?
Yeah. Well, sorry, it's that valuable. Jacobsen Construction understands our mission and our vision at Primary Children's, and they show up every day putting the child first and always. So I see the difference it makes when there is a partnership, and truly a partnership around the values and the importance of the project.
I couldn't imagine a better partner. They have really understood our patient population.
It's something magical, and they walk the walk and they talk the talk.
They have just gone above and beyond. They've been so bought into the mission here.
I have a son who's now okay, but he tried to commit suicide multiple times. And so I use that to having an awareness of what these kids are kind of going through.
A month or so after I got here, we're doing some underground work, and one of the dirt workers, he was kind of talking to him about his day, and he said, "Man, it's really weird being back here." I'm like, "What do you mean?" He's like, "Yeah, I was here as a kid. I stayed on this campus." And I said, "Oh wow, like, what was that like?" And he said, "It's the only place I didn't get beat. It's the only place I could get food." Right away, I was like, wow. The service that the Intermountain's providing to the kids here is very important. We're serving probably one of the most vulnerable demographics. Being able to play a small part in building a facility that's just dedicated to helping that population has been very rewarding for me personally.